Push, rip, the puzzles of pain. He walks in slow with a magnifying stare, looking at a spine that's twisted in the air. A hip too high, a neck off track. Don't worry, friend, he's got your back. It's the Postural Detective, solving your pain, finding the clues in your muscle strain. From ankle to shoulder, no joint left behind. He puts the puzzle pieces back in line. Postural Detective.
I don't like this music. What kind of a crap is that?
You never heard hip hop before in rap music?
Oh man, they don't know how to sing a melody?
What are you listening before? Like
Maybe
Mozart
something like Mariah Carey at least.
Who?
Mariah Carey, you heard of her?
No, never heard about her.
Oh my God.
Who is she? You got some pictures to show me?
Oh, you're driving me nuts.
Okay, yeah, me too. Oh man, do you like watch those STD pictures?
Oh, that is disgusting.
No, I love them. It's make me move better and work better. Okay, so it's your fault we're gonna stuck in this office and answer all those questions and answer all those phones now because you screwed up the last case, man. What the hell was wrong with you?
Here we go. Postural Detective David speaking. What is massage therapy and how does it work? What do you think of that? Hold on, we'll give you an answer for that.
Such a stupid question. How many years we've been talking about this? You have your way to approach?
Well, I think it's the hands-on manipulation of the muscles, the tendons, the connective tissue. You're improving physical function, you know. You reduce tension, you get the range of motion, you're working with the muscle very carefully. What do you think of that?
I think it's an old approach of what's the truly massage is, because I believe massage therapy, it's the number one healing instrument, the tool of people who's one person heal another one. And our body covered with the fascia, 90% of our body covered with the fascia. And between the fascia, it's another fascia. And this is how we move. This is how everything connected. And if your fascia is dehydrated, which is you're not doing any exercise, any stretches, any therapy, you're going to get in trouble because you're going to feel stiff. Also, it's release your cortisol. It's help to move your cortisol away from your body because cortisol, it's a stress hormones and you constantly in stress. And that's important to do massage. That's why you do massage constantly. This is like you brush your teeth every morning. You don't need to do massage every morning, but you need to do massage.
Yeah, I mean, we were talking about a little bit of circulation. It helps the joints move better. You got arthritis? I've had plenty of cases where we did wonders for it. And I like what you were saying there. I mean, that sounded very sensible.
Yes.
Well, thank you very much.
You can hang up on this idiot because I thought people already know what the massage therapy is. And you still ask those questions? Like I said, this is the number one treatment for you to go in the beginning. And take care of your body with the massage therapy. And the better massage therapy, the better result is going to be. All right.
That's right.
Hold on, I got some money from our last case. They paid up front.
All right.
Yeah, look at all this money, huh? Yeah. Here we go. Buy everything you wanted.
What do you think you're doing there?
It
was supposed to be half and half.
Half and a half? You should thank me I give you $100.
$100?
Yeah, you can go buy your wiki tobacco, whatever you smoke in there, dog.
I want half that money.
No, it's my half. I mean, it's your half It's my half. This is all you got, $100. You still as recruits. You're still new here, so
Well, I don't like it.
who cares, man? He don't like it. I don't like that. All right, it's another call. Go ahead and answer it.
David, Postural Detective. What are the benefits of getting massage? Well, what about that? I would say you got a ton of benefits. Pain relief. You can work on the headaches. You got all sorts of stress relief, relaxing the nerves. What do you think, sir?
What I'm gonna hang up this phone. Never call here again. Benefits of massage. Watch our previous videos and answer what we answered the questions before. Please stop calling here. Jesus, benefits of massage. Again, stress related, like David says. The fascia, dehydration of the fascia, the blood circulation, cortisol, whatever, what's to call people call this lactic acid. So you move the stuff around, you feel alive. Motion is lotion. You want to feel good, you want to move around, you want to do things, get massage and take care of yourself. If you don't, stop calling here, go lay down on your bed and cry like a little.
Well, we're talking about flexibility and mobility. You're doing sports, you're doing golf, you're doing tennis, you're walking around, you want to do anything, you need mobility. And you need to be able to move well and without pain, turn your neck right and left. What about that?
I watched this YouTube. You know what's the most watchable video on YouTube?
Oh, what's that?
How boiling the water. This is I'm true. Just type it in on YouTube. How boiling the water. Million and million people watch this video. This is how ridiculous people are. So massage, it's like I said, number one, heal your body. Like to take care of your body too. So stop asking those questions. Massage, it's number one healing tool.
That's right.
Let me get this call because it's always those morons calling. Hello. Yes. Don't ask me what's the benefits of massage, okay? Oh, okay. How many times massage you can do? How many massage you need per month? How often you do massages? It's a good question, actually. Yes. All right. So the best if you do once a week. So it's basically 4 times a month. And the thing is, if you're financial stable, if you're financial non-stable, even once a month, it's a good stuff and good result. If you do twice a month, every other week, it's still going to be good. The best result is once a month. Like I said, get that muscle ready. Get this, feel your body. Just through the touch, you feel how you are. And stressful, especially for these people, for business people who's don't know what's going on in this world right now with all this business. It's great because you guys stressful. And that's great for you to do this every month. I have a business people, they do every other 3 days. So I treat 3 times a month. 3 times a week. They financial stable, they can afford that, and they do it, and they feel great. I can see it's a big benefits for them.
Well, I would say that depending on whether you've got pain or an injury, and whether it's an acute problem or a chronic pain that you've had for many years, that'll depend on how often you would get one, because we can build upon that. Or do you just want stress relief? Because massage loosens up the muscles, relieves pressure on the nerves. Yeah. So for your wellness, you've got stress if you've got an injury. And remember, we do manual therapy here. Yeah. And that will fix a lot of injuries you've had for years.
He's full of shit. Let's hang up the phone.
Yeah. All right. I hope you got that right.
The word of fix, we can't say we fix everything to you guys, because we do only 10% of work for you. The 90% it's you, it's your mindset. If you want to be too healthy, you will find a lot of specialists, not just massage therapists, the personal trainer, a stretch instructor, meditation, some mental health too, because like I said, the massage therapists just do 10% of your health work. The rest of you, it's your mind and the way you want to heal yourself. All right, it's another call. You want to take it? Go ahead. All right.
David, Postural Detective. Hello. Yeah. How long should a massage session be? Well, it varies, but I would say it could be an hour, 90 minutes, 2 hours. You know, it all depends on how you feel.
No. Tell him how many hours you did that guy at the Beverly Hills on the hills. Tell him how many hours you did that massage.
Oh, well, sometimes I need to do 2 hours, or 2.5 hours, maybe 3. Well, I don't know. I kind of lost it. Too much smoking, you know, it kind of rots your brain.
Yeah, you should stop smoke that stuff for sure.
Well, what do you think?
Okay, so what I'm think, if you are seriously injured, if you have any pain, discomfort, massage, it's not supposed to be more than 45, 60 minutes. The 60 minutes and it's top. And sometimes what people do, they come in, they're in pain, and they think if the more time they're going to add to massage, the more it's beneficial for them is going to be. No, it's not true, because you're injured, you're in pain, massage therapist, and you get this 90 minutes. That's what massage therapist should explain, because the client book you 90 minutes massage, you will use all this 90 minutes because you don't want to lose that money and time, right? So what you have to say to your client, you've been injured, you need to focus on one particular part of your body, or whatever the problem is, and it's not supposed to be more than 45 minutes. It's have to be more often every other day, which is recovery time is at least 72 hours. So let's say I did massage on Monday, Tuesday, Wednesday off. The client come back on Wednesday evening or Thursday morning. And if this is relaxation, I don't know, like those Hawaii style with the cucumber water and that flowers in your hair and whatever that waxing, schmuxing, poxing, it could be the 90 minutes because it's take a lot of preparation. But if you're looking for like truly work, the postural correction, the pain alleviation, that's have to be not more than 60 minutes. And massage therapists, stop, try to help your clients at this in the 1 day and 1 hour. It's not going to happen, and you can create more pain and more discomfort in the body. Does that help?
Yeah, that makes a lot of sense.
Yes.
All right.
That phone need to be fixed. It's always collapsing. God damn it. This office is getting old. All right, let me get this one. Okay, Postural Detective, this is Jake. Yes. Okay. So the question is, what massage should I pick? Yes, it's and what's the difference between massages? It's kind of, you know, I would say till 2015 you can ask those questions. Now it's two type of manual massage therapy or manual therapy, which is going to focus on correct your pain, correct your posture, and just relaxation and stress related massages. In stress related massages, it's all inside those hot stones, Swedish massages, or whatever, reflexology. What else we can do? Shiatsu, shmuatsu, puatsu, whatever. Shushi, mushi, pushy, motherfucker. That's what I'm trying to say. So, the medical massage, it's the one. It's not like a deep tissue or whatever. The people say, let me hang up that phone. Deep tissue. what's the difference between deep tissue and Swedish? People just go stronger and deeper. No, deep tissue, it's mean you go in between those layers. It's unnecessary. You put too much pressure, and people love that pressure because they experience pain. You're not supposed to experience pain doing massage. So pick the right therapist, let's say it this way, and he will guide you what you exactly you're looking for. If you're in stress, he will see it, he will understand it. If you're in pain, he will apply his technique. If you don't understand this, you have to find the right therapist, and of course go to profile and make a phone calls to the therapist and explain your situation and your story and see if this client can help you. The therapist can help you.
Mm-hmm. Well, look, if you want to do Swedish, that's for circulation, relaxation, sleep. It's very relaxing and very soothing. Most of my clients don't like it, but it can be very relaxing.
If you want to do Swedish massage, go to Sweden, okay, and do massages up there. But in Los Angeles, we're serious manual therapists who try to help you to work on your posture, do assessment, and truly work on your body. I'm sick of all those calls. Your next one. I don't want to answer that one.
All right, here we go. David, Postural Detective. Does a massage hurt? Or how much discomfort should I expect?
This is the first good question, because a lot of people, like I said, they love those painful massages because they're thinking the more painful massage is more beneficial. The more pain, that means something non-functional, and therapists use too much pressure, or he's applied the pressure to the painful area, or the speed of massage, the movements is very fast. If people are going to use this hands on that lower back and it goes so fast and deep, it's going to be painful. And what's going to happen, you can't relax. Your body is going to be guarded and not relaxed, because your brain is work differently than you think. Your brain is trying to protect you. If brain feel pain, this is what's going to happen. You're going to contract it and hold it. And that's not a good stuff. So no pain during massages. And the pressure have to be moderated. Your therapist always have to communicate with you and ask you about the pressure. If you were like this and you're in pain and he never asks you, run from this therapy. Run from this office and never go back. Do you have something to add, David?
Well, look, you might feel a little bit sore when you're working on them. Very mild. It's not pain. You're talking, and the therapist should be communicating. It's all about communication. And you got to be able to listen to your client and be able to understand that they're telling you, whether it's too deep or not, but you know what you're doing, and you're not going to mess anything up. Because you know anatomy. We know anatomy, don't we?
We do, yeah. And pathology. That's what you need to know, because every case is different. If you come in with, let's say, Parkinson disease or something, have to be treated completely different than other, or diabetes people, or some kidney problem. It's all contraindication and local contraindication, which mean you can apply pressure in particular area. It's a local and completely contraindication. You can't get massage till you get a prescription from doctor or get out of this situation. Let's say, simple example, client call about lymphatic. The legs is swelling. So if you are pointing that tissue, muscle, and you can see that the fingertip is still there and its skin is not pops back like I'm right in here. Push it, and it pops back up. So a lot of edema, people pushing that finger, you can see it, and it slowly pops up. That's mean it's been very deep edema, a lot of a water problem, circulation problem. I don't think you should do that massage in there, but people do. And guess what? Creates some more problems. So that's why you're booking through the professional therapy who've been licensed and insurance, especially if you experience pain and discomfort. Oh! A lot of call, huh?
David, Postural Detective. Can I request more or less pressure during a massage? And what should I wear? And do I have to take my clothes off? What do you think of that? I think they want information.
I'm thinking how we're gonna spend this money on the Christmas. I'm probably going to Las Vegas, man. I'm gonna get that roulette's going. Okay, go ahead.
While he's thinking about Las Vegas, I'm gonna tell you something. The pressure that you're gonna need is level. The therapist has got to have expertise, and they're gonna tell you exactly the right amount of pressure. It's not gonna be too light, and it's not going to be too heavy. And it's like in that piggy story where the bed is too soft and the bed is too hard. It needs to be just right. And what should you wear? Well, you can wear whatever's comfortable.
If you do sport therapy, if the therapist, usually the therapist can tell you over the phone, if we're gonna do a lot of movements, the woman especially have to bring the shorts or sport bra because it's a lot of movements. If this is like more relaxation massage, of course you just wearing the regular clothes like casual. The thing is, do not dress like fancy, those expensive brands, because sometimes some massage therapists use a lot of oil, and when you put this the dress on your body, the oil has come to your dress. And if this is, let's say, white, and you're gonna see it's gonna sticking out. All those Chanel, Monel, whatever, those clothes, it's happened before. That's what I'm like. It's laughing. So don't wearing expensive stuff. Sport bra for the woman, sport pants. For the guy, same sport shorts. If you move a lot, if you do some sport therapy, if you do rehab, bands like a physio massage, which is great. And the pressure, yes, it's also always about communication. But I know some people like pain because they think through the pain. Like I said, they still alive. They feel that sensation. That's all they want, and it's not healthy. Look what I found. I found my East Western Healing Art Institute of cupping and herb and gua sha work. Look at that. I just found it.
Wow, nice.
Yeah, it's been a what year? 2011. Look at this. 14 years ago, I get this certification. That's why I found this right in this book. Look, they still have a CD.
David, speaking, Postural Detective. What happens in my first massage appointment, and what should I tell my therapist in advance? Well, you're going to have to tell your therapist about your health history. You're going to have to tell them about previous injuries. You want to tell them all the things that are related to your pain and what's happening. And a lot of people, they don't speak up. They don't speak up enough, and they don't tell us nothing. And that makes me mad. But it makes you even madder.
Oh, yeah, I'm so mad on those massages. I'm going to tell you the funny story. So, yes, it's mad. I'm mad because the first impression have to be very, let's say, bright and open boundaries. I would say ask as much as questions as possible. Our system, when you book a massage through our system, it's going to ask you the intake form question, which is important because when the client's already arrived, I already know what's going on with my client. He says neck pain. He described that fall down from the bicycle and take this medication and that. This is my system. Now we have a precision, which is called assessment, right?
Assessment.
Partial assessment, which is we ask 10 regular questions. Just if you don't experience any pain, we ask you 10 questions. And if you do feel pain questions, we're going to ask you why this come from, what kind of pain is that, what level of the pain, what's help to your pain, Is that constantly? How long it's been there? All those type of questions, because it's important to build this nice, I'm going to say, not assessment, the preparation for the treatment. And of course, after the treatment, reassessment, because we want to see the benefits of the work. If that could be the next question. If massages didn't help me, should I charge my money back? No, you can do that. What you can do, if you don't like the environment, if you don't like that first approach, like I said, no questions asked, no forms, no talking, no introduction, no talking to the client. Just go ahead, lay down, undress, and that's it. That's all people say. This is the bad place. You should be worry about this. So if it's not happening, if you don't like the pressure, if the therapist is not doing what he's supposed to be, not asking about pressure amount, not asking about your comfort, you should get up and say, I would like to stop my session. You can stop the session 15 minutes after the session and not be charged. If you just say, I would like to stop my session, cancel my session, you get up, get dressed, and go. But if you finish to the end, or at least half hour and finish to the end, and you say, I don't like massage, I want to get my money back, it's not supposed to be happening. Of course, people will give you because they try to be nice to you, but most of the time, it's not going to happen. So stop your session in 15 minutes.
Well, if you have a medical condition, you have to speak up and you have to tell them what you got. So if you have a certain problem with your kidneys or blood sugar problems, I mean, this is the therapist. See, we're licensed in California. There's a California state certification. Not everybody in California has got a California state certification. Isn't that right?
That's right. That's right. That's right.
So we want to know medical problems, chronic pain, broken bones from the past, and all those things. So that's an important thing.
Let me get that one. Okay, the next question. It's hold on. Let me. Okay, yeah, it's Jay, Postural Detective. Correct. If massage safe? No, it's not. Massage is not safe. Why? Because sometimes therapists don't know what they're doing. And it's the more medical condition you have, the more to the specialist you have to go. If you have sciatica and you just open that first whatever, like Google or Yelp, and you see this, Blue Lotus massage, or some, I don't know, Happy Buddha massage, or some red light massage, and you're going to go up there, like I said, they're never going to ask you questions, lay down on the floor, lay down on the table, they're going to start work on you. That could be the damage. Just think about it. If you come in and you have a bulge disc, people don't know that. You don't know that. But the professional therapist is going to ask you the questions. They do a couple tests, and they find out you're in danger. You have to sign the waiver for them, because you can put in danger them too if they do something bad. And also, the professional therapist will send you to do MRI or X-ray and not going to do anything on you till you shows up back to the office with those reports. But the bad therapist, like I said, he's going to jump on you. They're going to walk on you. They're going to jump on you. They're going to stretch you. They're going to pull you and create more damage. So be careful if you experience chronic pain, if you have acute stage pain, and let's say you get car accident and you think you're okay, but you're not. You got might be whiplash, but you go to the office and, like I said, therapists never ask you questions and start work on your neck. It's happened before. So as a therapist, always sign the waiver, and as a client, also be careful and see if the therapist is not qualified for your condition. If you're just a regular guy, come in, want to relax, I don't think you get any danger. But, like I said, depends on communication and depends on therapist.
Absolutely.
All right. Is that the last one today?
Oh, yeah, let me see. There's one more call here. David, Postural Detective. What's the difference between a therapeutic massage and a relaxation massage?
It's another one, that ridiculous question. You go ahead. I'm not going to answer.
Well, look, a therapeutic massage is more geared with knowledge, and they're going to find out that your history. They're going to figure out the proper treatment for you. They're going to give you ways. The treatment is going to be perfect for your pressure and your history, and it's going to increase the range of motion if that's a problem and get rid of the pain, but in a professional way. A relaxation massage is one you could fall asleep to. And it's just sort of circulation and rubbing, and it's good if you need to get some sleep, but it doesn't fix injuries.
We don't fix injuries. You're the person who try to correct it and try to help yourself. Like I said, we just give you a 10% of our healing, try to heal you through this joint mobilization, through the tissue work, the fascia, of course, and like I said, try to help. And the communications and build this relationship between therapist and clients, that's the most important. Are we done for today?
I don't mean that it's fixing. I misspoke.
No, it's fine. It's fine, because people is not the cars. You're not the machine. You're more than that. I mean, your body is probably a machine. You need to know how to work with that. I mean, how's the body work? And check every time. That's why you go to a massage therapist and ask him, hey, how's my hip today? And my hip is okay? And your therapist has said, yeah, your hip is fine. Oh, but your ankle is a little bit not fine. I check your ankle, and ankle is not right. So we just need to work on that, about that. That's all about that massage therapy is. For sure, LifeRx is for sure. LifeRx and Postural Detective, this is why we're different than others. We do the regular stuff, but we more than that. And for the good price, you can receive a great massage therapy in Los Angeles and metro area. We go to your house, and we have only several massage therapists and agent, the Postural Detective, who can truly help you. And it's really difficult, trust me, to get one and educate them, right?
Absolutely.
Because some of them, the new guys, don't want to listen to you.
No, they don't listen.
They don't listen.
Young folks,
They don't listen.
They don't listen. They got an attention span of a gnat.
Yeah, they think they know everything, and they tell me, don't tell me, I know how to work, and it's no result. But if you get this truly great therapist, they will definitely gonna help you, and you will see the difference between relaxation and therapeutic massage. But they both great. Don't get me wrong. I love those relaxation massage, because you get in stress. You just want to lay down. You don't experience pain. You just want to fall in sleep. And most of our clients is falling asleep when they stressed. And that's also relaxation and therapeutic massage at the same time. I don't want to divide them. This is manual therapy work.
Mm-hmm. Oh, very good.
You guys have a wonderful day. Book massage if you need it. We're in Los Angeles. Like I said, we have at least 4 or 5 agents left. Most of us is try to do the best therapy for you.
All right. Good to meet you.
See you later.